Here's what we know so far. There are 3 patients, 2 men, 1 woman in Thurston, Pierce, and King counties. They range in age from 29 to 39. King 5's Christine Pay has been following the developments this evening. And Christine, there's just one thing health officials want everyone to take away from this announcement.
That's right. It's what we've been hearing from public health officials ever since Omicron was confirmed in the U.S. There is reason to be concerned, but not to panic. And Washington health officials echoing that tonight, saying the information we have so far is still limited.
It's the update we all expected eventually.
We have been saying it's not a matter of if, but when, that we would find Omicron in our state.
The state health department confirmed Saturday afternoon 3 Omicron cases in Washington, making it the 13th state in the U.S. to detect the highly infectious variant. Washington's cases include a man in his 30s from Thurston County, a man in his 20s from Pierce County, and a woman in her 20s from King County. Health officials don't know yet their conditions or travel history, and the health department was unable to say if the 3 were vaccinated.
That, as well as vaccination status, are key details that we expect to learn more as we continue our investigation efforts in the coming days.
What health officials do know at this point is robust testing for Omicron will continue.
That's what allowed us to detect this so quickly, is an increase in our surveillance efforts.
The DOH says the positive samples were collected between November 29th and December 1st and confirmed in a state lab. They say Washington was primed to find Omicron quickly with the power of UW-Medicine's virology lab, which has been sequencing hundreds of positive samples a day.
There are rapid PCR-based screening methods that we can use to find certain variants within hours.
While Omicron has arrived, health officials say Delta remains the dominant variant in Washington. The preliminary expectation is Omicron could overtake Delta.
I hope I'm wrong, but I expect we'll see many more cases in the coming weeks. Exactly how many and how severe they will be is less clear.
The health department also addressed the possibility of another lockdown.
There is this persistent message or rumor out there that there are lockdowns in place, and there are not.
Shaw and his team consistently say getting vaccinated and boosted is the best way to protect against variants right now. As for their efficacy against Omicron,
All of these are going to take weeks. So we're not going to get answers in 24 hours.
Something else that was brought up, what about young children who can't get vaccinated yet? How can they be protected against Omicron? Well, the state health department's chief science officer says its best tool to protect those too young to get vaccinated is for everyone else in the family to get it. Also, masks are consistently recommended indoors and in crowded spaces. Back to you, Sebastian.
Christine, thank you.